Welcome to Health Matters. In this episode, we'll learn about a new method of prenatal care available at Brattleboro OB/GYN called Centering Pregnancy. Let's first take a look at the basics of this program.
Prenatal care in the United States isn't working the way it should. Too many babies are born too early, costing the U.S. $26 billion each year. Many providers and staff say they feel challenged to give pregnant women all the care and support they need. Given how short prenatal visits are today, it's no wonder patients are often left wanting more. Time and budget constraints make it hard for providers to give pregnant women the care, education, and support they all need. It's hard to admit, but in our hearts, we know. Our system of prenatal care needs fixing. It's not possible to tell pregnant women everything they need to know in a 12-minute appointment. Something has to change. The good news is that a vehicle for change exists. It's centering. Centering combines patient health assessment, interactive learning, and community building, and it all happens in a group space. Also, women take an active role in their prenatal care. In a facilitated group, they learn and share with other women who are going through the same experiences at the same time. Women in centering have the benefit of 20 hours face-to-face with their prenatal provider, compared to 2 hours in traditional care. Centering reduces preterm birth at a huge cost savings. Centering also increases breastfeeding rates and patient satisfaction.
Next, we'll talk with Heather Ferreira, certified nurse midwife, and Alycia Hodgman, medical assistant, both from Brattleboro OB/GYN. Great. So Heather, Alycia, thank you for coming here today.
Thank you.
Being with us. So let's talk about Centering Pregnancy. It's a program at Brattleboro OB/GYN. And what is Centering Pregnancy?
So, Centering Pregnancy is a unique model of prenatal care that combines some of the elements of traditional prenatal care. So we still do the individual check-ins with each mom and listen to babies and measure bellies just like you would in any regular prenatal visit. But there's also additional education and social support that's sort of wrapped into your prenatal visit.
Great. So Alycia, how does Centering Pregnancy work?
So roughly we have about 10 women and their support people who come together. You still have your intake in the office and an OB physical and some additional appointments with some other providers in the office, but you meet as a group. You get your one-on-one session and then we all come together and do an educational portion.
We cover topics such as breastfeeding, contraception, newborn care, labor preparation, postpartum depression, like lots of really good information that is useful for pregnant women and their partners.
That's great. And so, just as you said, who can participate and who can't participate in these sessions?
Any pregnant woman that's receiving care at our practice is eligible to participate, as well as their support people, but we do ask that other children are not brought to sessions, just to keep the focus on this particular pregnancy for those women.
Exactly. So when would a Centering Pregnancy group start?
Between 12 and 16 weeks of pregnancy. So they have their intake and then they have an OB physical and then their next visit would be a centering group.
Sure. And so after going through all these sessions of Centering Pregnancy, what happens when the participants give birth?
So we, after the last woman in each group has given birth, then we have a reunion where we invite all of the participants to come back and bring their babies, and we all enjoy each other's company again and take really great pictures of all those cute babies and have cake. Because now that they're no longer pregnant, we can offer them cake. Yeah. We try to keep snacks healthy during their pregnancy, but afterwards, cake is fair game.
Yes. So what are some benefits of participating in Centering Pregnancy?
So centering participants are better prepared for labor and birth. We've actually even had some of our birthing center nurses comment on how prepared the women are that have gone through centering. They can tell the difference between the women who have participated in centering and those who have not. And there's higher rates of breastfeeding. About 90% of women who do centering go on to breastfeed their babies.
And I believe in our office it's 97%.
Wow, perfect. And there's also lower rates of preterm birth and lower rates of postpartum depression.
Great, wonderful. So if women are interested in registering for centering pregnancy, how would they go about doing that?
They can call the office, or at their intake, when it's discussed, they can just let either Jess or intake nurse know about it, or any of the nurses or providers, or even the receptionist.
Great, wonderful. Well, thank you for joining us today.
Thank you.
Thank you.